excited to be here because I'm really glad that I have the chance to teach you something about psychiatry. So my name is Afra van der Markt, and I'm almost a psychiatrist. As Ning said before, please don't call me a psychologist. I'm not a psychologist, and I'll tell you why in a minute. And I'm also doing a PhD in staging of bipolar disorder, but I decided to do my talk today about the common misconceptions that people have about psychiatry. So the first one is that psychiatry and psychology are the same thing. They're not the same thing. They do have some things in common. They both start with psych. They both treat patients that have problems with their mental health. We both do scientific studies in sort of the same field, like we both try to answer the same questions. And we both cannot read minds. So yes, no, we cannot. There are some differences. So the first difference is that psychiatrists, as you might know, are medical doctors, so we're part of the medical field, and psychologists focus more on the science of mind and behavior. Well, we've met, like me as a psychiatrist or a trainee in psychiatry, have been to medical school where psychologists have studied psychology, which means we can prescribe medication, they cannot, but they are way better in psychotherapy, so they're better as psychotherapists. The second misconception, schizophrenia means having multiple personalities. This is something that, unfortunately, I still hear a lot. This meme is actually correct, and I'll tell you why. So schizophrenia means to have a split mind, and but what is meant by that is that it's split from reality and not into different pieces, but this person's mind is split from reality. Schizophrenia means to have recurrent psychoses, and what a psychosis is you have delusions and hallucinations. A delusion is a thought that's not true, for example, like I'm being chased by the CIA, and a hallucination is something you hear or see or feel that is not actually there, for example, hearing voices. What is meant by when they're talking about schizophrenia in this case, or the misconception, what the misconception is actually about, is multiple personality disorder, which is also called dissociative identity disorder. And this is a very controversial diagnosis, which has not really been proven yet. There are lots of people working on it, but we don't really know what it is yet, but it does mean that sometimes you function as a 5-year-old child, sometimes you function as an adult male. You have all these different personalities inside of you, and they sometimes come out, but that's not called schizophrenia. All right, so the next misconception. Who here has diagnosed themselves with OCD based on a picture like this? Okay, that's false. So OCD means obsessive compulsive disorder, and it consists of having obsessions, so obsessive thoughts that you cannot get rid of or that cause anxiety, and compulsions. And compulsions are a way to try to get rid of that thought. So for example, you think maybe your family is going to die if you don't count to 10 every time you fold your laundry, and then you try to count to 10 every time you fold your laundry to make sure you don't get all that anxiety. Why this meme is not OCD is because in order to call it OCD, it has to be time-consuming, so it has to last more than an hour a day, at least. It has to cause clinically significant distress, so that means anxiety or otherwise, unpleasant feelings. And it has to cause an impairment in functioning. So some of these people spend all day doing their OCD. I will give some examples of what kind of types of OCD there are. They're not separate diagnoses, and many patients have a little of all the categories, but it's just easier to understand it this way. So the most common one that you probably know is to to want to have symmetry and counting. So these people get really anxious if things are not symmetrical, if they're not in a certain number. For example, you have to have 2 of each or even numbers. And they usually try to solve this by making sure that everything is either symmetrical or in the right amount of numbers. Intrusive thoughts. So these people have very severe thoughts. So for example, when they're walking on a bridge, they think, I'm going to jump off, I'm going to jump off. And so usually when people have this, they try to avoid going to these kind of places. Checking. Lots of people have this to some extent. So for example, you keep thinking, oh, what if I left the stove on? So you have to go back and then back again to make sure you haven't left the stove on. But again, I want to emphasize this, what I just said. It has to be one of these 3. So time-consuming, cause anxiety, or impairment in functioning. And then there's the contamination one. It's also a very well-known one, where people constantly think that they're dirty, and they have to counter this by washing their hands or washing themselves continuously. All right, so the next misconception that I want to talk to you about, oh, sorry, hoarding, I forgot this one. Well, the thing about hoarding is it's now a separate diagnosis, but lots of OCD patients have symptoms of this, and the weird thing about this is that it goes against what you think about OCD. So you think, when you see an OCD patient or when you think about an OCD patient, you think that they probably are very clean, very organized, but these people have trouble throwing things away or getting rid of things. So for example, I had a patient who was always thinking, if I throw my old paper away, I might throw away my keys as well. So she couldn't throw away anything, and she just started hoarding, and their house became a huge mess. So that's against what you usually think when you think about OCD patients. Okay, next one. All nerds have autism. So there are many articles on the internet talking about nerds having autism. There are some TV shows where you see nerdy people that are implied to have autism. In a lot of these articles, they talk about Newton and Einstein saying that they had autism as well. Well, let me get into that first. You cannot diagnose in hindsight. So they were not diagnosed ever by a psychiatrist during their lifetime. So now we cannot go back and say that they had this because they haven't been, seen by any specialist. So there has been a really big study that wanted to know if nerds are more likely to have autism. What they did is they included 500,000 people, which is a huge study. I don't know if you guys are in research, but that's a lot of people to include. And they all made them fill out the autism spectrum quotient, so the AQ. What came out of this study is, I'll explain this picture to you. So what you see here is their AQ score. So it goes from 1 to 50. Here is the amount of people that had this. And what you see is that if you look at this blue line, which is males, they're a little further to the right than the females. The females are a little further to the left. So what they concluded based on this difference is that males have a little higher chance of having autism than females. They did the same for what they called nerds and non-nerds. We can discuss about this, but they said nerds are people that work in science, technology, engineering, or mathematics. I'm sorry, guys. So again, you can see that these people that didn't work in a STEM profession are a little more to the left, and the people that work in the STEM profession are a little more to the right. So you would think, okay, based on this, okay, maybe nerds and males are a little more autistic than females and non-nerds. But the problem with this study is that they asked everybody who watched the TV show about our bodies to fill out this questionnaire. This was in the UK. And it's a questionnaire. It's not a reliable diagnostic instrument. It's just a screener. So based on this, because the screener is not a very reliable way to set this diagnosis, because the screener has questions like, do you prefer to go to a library or to a party? Would you rather go biking by yourself or doing something in a group? And so based on those kind of questions, you cannot really set the diagnosis of autism. So I would say that based on this questionnaire, if I would have patients that have this difference, I would say they're more or less the same. So I think based on this, we can all conclude that there's no difference. I want to tell you guys some more facts about autism. Being socially awkward is definitely not the same as being autistic, and this is, I think, where most of the confusion comes from. In the Netherlands, I just wanted to give you some idea of how prevalent it is. 2.8% they think of the people have a form of autism, so it can be a very mild form. And more men are diagnosed than women, but this might be because women are underdiagnosed, because it's very, women are raised to be more social than men, so they might be better at hiding their autistic symptoms because they just learn to act more socially. That's just what's required of females more than males to adjust. Right, I'm just gonna take a sip of water and then we're gonna go to the next one. Okay. All right. So autism is caused by vaccines. Who here, do we need to go into this, or is there anyone who believes this? Yeah. All right, I'll go into it. So this was propagated by the Oprah network a lot. And so it made a lot of parents very concerned. And yeah, I heard the word Trump. Trump tweeted about this more than 20 times before he became president. After he became president, I haven't found any tweets about this. But yeah, he thinks that we should be very careful with vaccinations. So, sorry? Oh, well, okay. So where did this misconception come from? There has been an increase in the diagnosis of autism. It all started with a publication by Wakefield et al. In The Lancet, which is a very important journal for us. And what he said was that the MMR vaccine caused autism by damaging the intestinal lining, which allowed the entrance of encephalopathic proteins. So certain proteins could go into could go through the intestinal wall and might damage the brain. This vaccination occurs around 1 and 5 years of age. So they saw a clear relation between the vaccination and the autism. This publication has actually, The Lancet has said that this publication is very wrong. They subtracted it. And this Mr. Wakefield actually lost his license as a medical doctor because of this publication. Because what he did is he went to a hospital, waited until autistic parents came to him who were concerned. He included those into a case series and then just let these autistic children go through a lot of useless tests to prove his hypothesis that this was the causal pathway. So I think we should really stop saying this and also fight anyone who, I understand parents are concerned about their children, but I think it's better to have your child vaccinated than to believe something that's not true. So let's fight this. All right. Okay, next one. Therapy means lying on a sofa and talking about your mom. That's something unfortunately, I get that question a lot. And it's really hard to disprove this scientifically, but I tried. So the first thing is, where does this come from? Freud, who is sort of the founding father of our current psychiatry, he actually had a sofa. It looked like this. You can still visit this when you go to London. You can see this sofa where he treated his patient, and this is where he sat, behind the sofa. He sat on his chair. He thought that it was better not to make eye contact with your patient because they could, introspect better. They could focus more on their own thoughts and their own feelings. Nowadays, this is a more likely setting. So 2 chairs, sometimes 3, sometimes group therapy, so a whole circle of chairs. But we don't, like, this is not really done anymore. We now do it like this. And then, so I was wondering, like, is there any scientific proof that this is better than this? And there is one publication, so it's not really scientific, but there is one publication that said that using the couch has never been proven to be helpful. So therefore, we should probably not do it. So do people only talk about their mom when they go into therapy? Well, this again is really difficult to prove scientifically, but I have found a list of recommended topics to talk about with your patient, which was brought out by the American Psychological Association. And what they said, well, they have a lot of topics that you can talk about, so you don't only have to talk about your mom, you can talk about other things. And what I found really curious about this list, I understand it's a lot to read, so you don't have to read all of them, but what is on it is Christian perspective in family conflict, father-child relationships, but I didn't see anything about mother-child relationships, so apparently we don't do that anymore. We don't talk about moms anymore. Or at least it's not so important that the American Psychological Association still wants to mention it on their website. All right, let's move on to the next one. So who's seen this movie? Yeah, One Flew Over the Cuckoo's Nest. So this image is still really in a lot of people's minds when they think about ECT or shock therapy. This is not how it goes, fortunately. So we now call it electroconvulsive therapy and not shock therapy, because it just sounds a little nicer. And it's done under general anesthesia, which means that these people are asleep when it's done. So they don't feel anything, they wake up from their anesthesia, and they just, they don't even remember being shocked. So how does this therapy work? Why do we think it works? We are not 100% sure, but we have a theory. So there is a small electrode that's placed on the head. You can see that here. And we know it causes an epileptic seizure. And we think that somehow that resets the neurotransmitters. So people who are, for example, depressed, have a sort of a reset, and then they're not so depressed anymore. But there's still a lot of research going on about why it works, but that it works is very clear. There are some side effects: nausea, muscle and headache, that's very common, and short-term memory loss, so right after they wake up, which is like with any anesthesia. When you wake up, I don't know, has any one of you had anesthesia? When you wake up, you're not really, you don't remember everything. Well, it's like that. You have some memory loss, short-term, and then you become, you have your memories back. And so I actually think this is a very good therapy, because compared to medication, if you want to treat depression with medication, you would have much more side effects than this. But it's because of these images that people still remember, that it's very hard to convince people to go for this treatment compared to medication. All right. So I wanted to add one slide. So this is an actual ECT session that's done in the VUMC. You can find this on YouTube, but I didn't want to put video in my PowerPoint presentation, because that's just asking for trouble. So this is the electrode. You can see the woman is, just calmly asleep. And he places the electrode on her head. He checks her heart rate, her pulse, like her blood pressure, everything. And what you can see here, what this image I think mainly shows, is that, she doesn't seem to be suffering. So, okay. So much about ECT. Let's move on to the next one. So if your friend doesn't yawn with you, he's probably a psychopath. So the way I found out about this misconception is, I have a friend, I was Skyping with him, and it was very late at night, I started yawning, and he opened his mouth, and I was like, what are you doing? He's like, and I'm like, what are you doing? He's like, yeah, well, if I don't yawn with you at the same time, you're probably going to think I'm a psychopath. So So I looked into that. I looked if there was any proof for or against this. What is a psychopath? A psychopath is a person usually with an antisocial personality disorder. So this is a person who has a lack of empathy. They don't feel the same feelings of empathy that we do, which might also mean they don't yawn when you start yawning. I don't know if that's really a feeling, but okay, it's something you mirror. So there has been one study about contagious yawning, and it found that it's a common phenomenon affecting upwards of 60% of healthy human beings. So what I think we can conclude from this is if you saw this picture and 60% of you guys started yawning, there are probably no psychopaths in this, yeah, I don't know. So, all right. So I have some take-home messages that we went over. Psychology is not the same as psychiatry. Schizophrenia is not the same as multiple personality disorder. You probably don't have OCD. Not all nerds have autism, and autism is not caused by vaccines. Therapy does not mean lying on a sofa and talking about your mom. Shock therapy is not horrible at all. It's actually maybe a better treatment. And not being susceptible to contagious yawning does not mean you're a psychopath. Thank you.